Okay, hello everybody. I think we'll start now. My name is Jonathan Schofield, Professor of Social Work here in Cardiff, and it's my pleasure to be chairing today. I don't have very much to do. I'm just introducing things now, and then I will stay very quiet until the end of the presentation when I'll be fielding the questions and picking them up. So without any further ado, I'm going to hand over to Jeremy. So we've got Dr. Jeremy Dixon, who's a senior lecturer in social work from Bath, and he's going to tell you about a study done with a couple of other colleagues I can see here, one from Canada, one also from Bath, on the very interesting topic of romantic need, exploring romantic need as part of mental health social care practice. So I'm sure Jeremy will introduce the study himself. It's great to have him along. Jeremy's increasingly developing, a reputation as a really important researcher in the field of adult mental health social work, and it's great to have him here. So Jeremy, over to you, and I'm going to put my mute on now and say no more for a bit.
Okay, well, thank you for that very generous introduction, Jonathan. So as Jonathan mentions, I'm based at the University of Bath in England, and I'm talking about a pilot study that we have done looking at this topic of exploring romantic need. So just to say, first of all, that this study was funded by Avon and Wiltshire Mental Health Partnership, and my colleagues, Professor Rachel Forrester-Jones and Beth Janes, who also contributed to this study. And the findings can be found on a paper which we've published, and it is open access, meaning that you can get it for free. And I will put a link to that paper up at the end of the talk if people want to read the full version. So let's kick off and think about why this topic is important. So when we looked at the concept of romantic love and did a bit of research around it, we noted that it's an important topic which has been the subject of romantic literature. It's something we're all familiar with. If we go into art galleries and look at pictures from a long way back, we see pictures of romantic love, and if we look at literature, we see those things as well. We can also see that it's been covered by philosophers, linguists, neuroscientists, anthropologists, and sociologists. So it's something which is of interest not just to social work researchers or health and social care researchers, but to all sorts of people. And if we think about how it's defined, we could say that the concept of romantic love is contested, but generally speaking, we're talking about a desire for an attachment to another, which is intimate and reciprocal. So there's not been an enormous amount of research studies looking at this area, and the scope is a bit limited. But if we do look at what's been written, we can see a few different kind of lines of inquiry that researchers have taken. So a systematic review of quantitative research on romantic relationships and sexual intimacy in people living with psychosis identified only 2 articles in which the issue of romantic experiences were talked about explicitly. And in the majority of articles that they reviewed, which was 43 in total, they identified that the subject of obstacles to intimacy came up most frequently. So although the literature that we have found is quite limited, there are a few things that should be noted. So the existing research suggests that people do have a strong desire for a reciprocal romantic relationship and want to meet a loving partner. So in one paper by McCann, which is a bit old now, 2010, 30 people who had been diagnosed with a mental health problem identified the need for a romantic relationship. And this was a quant study, and they identified that 83% of people wanted that. The issue of developing a romantic relationship and maintaining it has also been identified as something which people feel is important to feel normal and part of everyday society. But we also see that people who have psychosis from the research tell researchers that they lack confidence in making such relationships. And if we look at some of the psychological studies which are done with people more generally rather than people with mental health problems, we can see in these stigma-based studies that even if somebody meets somebody attractive, if they tell them that they have a mental health problem, that tends to put them off engaging with them in a romantic way. So moving on, let's think about this from a policy perspective. So the government's mental health policy, which is quite old now, from the coalition government, but this is still the most recent document, identifies recovery as central to mental health services. And we also know that wellbeing is central to adult care legislation. So the Social Services and Wellbeing Wales Act speaks about the importance of wellbeing and also of forming relationships as part of that. And the Care Act in England also highlights wellbeing as being an important thing as well. So national charities have looked at these things, but services don't tend to look at it very often. So as I've identified here, some research has been done looking into how social networks can be increased for people with mental health problems. And I know you had Martin Webber here yesterday, and he's done some important work on this. But these studies are fairly rare, and they tend to be focused on building people's social networks more generally, rather than focusing on romantic relationships. So there's a bit of grey literature if you look on the websites of mental health charities, and they identify that romantic need is important and sometimes give some advice, but they also identify that supporting someone with mental health problems with romantic need may raise some ethical issues. And there's a question about whether it's right to build up the expectation, I suppose, that relationships should be supported. There's an unease about whether you're giving people unrealistic expectations about what they might expect. However, from my perspective and the perspective of my authors, we do think that this is an unmet need and was something that we wanted to look at. And my co-author Rachel Forrester Jones comes from a background where she's also looked at the experiences of people with learning disabilities as well as people with mental health problems. And this is something which has been explored more thoroughly, I think, in the learning disability field than in the mental health field. So we wanted to think about it in this setting and see what people thought. Okay, so I'm going to move on now to talk about the methods that we used. So this was a pilot project, and we're hoping to use the results to build a larger project, but we did focus groups with 10 people with mental health problems, 6 carers, and also 6 professionals. So I'm sure that most of you know what focus groups are, but essentially you will get groups of people together where you will ask questions and talk to them about a particular issue. And people who write about focus groups, like Jenny Kitzinger from Cardiff University, have identified that the strength of this method is that you get people who've got similar experiences together, and they can then bounce off each other. So people can identify things they have in common, but also differences of opinions and approaches. And that sort of group interaction can be useful for teasing out some of the issues from different people's perspectives. One of the professionals wasn't able to join the focus group, so we interviewed that person separately. So we had 3 research questions which we used to guide the study. So they're set out here. So we were interested in the experiences. So, you know, what experiences do people with mental health problems have as regard to romantic relationships? We also wanted to know how family carers viewed this issue and how social care practitioners thought about it, and whether they actually provided any support to form and maintain such relationships. So we recruited through a number of different organisations in the southwest of England, we started out with a charity which supports people in regards to housing and mental health. And they initially thought they could recruit quite a few service users, but that was a bit tricky in the end. So we did recruit some staff through them, but we used a number of mental health organisations, and they were quite keen to take part. I think the issue with the charity was they were a bit protective of the service users and thought maybe this wasn't something that we should be asking them about, and maybe people would get distressed by this. But when we spoke to the mental health user groups, they were very keen to take part, and so we had a number of focus groups through the Hearing Voices network, and also spoke to people with mental health problems, a couple from the charity as well. So we used thematic analysis, which is a way of looking at themes and codes throughout the data, codes and themes throughout the data rather, and we also put this through a university ethics committee. So these committees, as most of you in academia will know, ask a lot of questions about your study, and we had to identify that we were going to explain the research to people properly, that we were going to identify ways in which they could sort of weigh up the pros and cons, and that we were going to interview and do focus groups with people who had the capacity to take part. So in other words, to weigh up the pros and cons of taking part and give capacitated consent. So the service users and carers were paid for their time, but we didn't pay professionals for their time. So let's think about what the findings from the study were. So first of all individuals who took part acknowledged that it was important for people to develop and maintain loving relationships, and they saw that as being linked to the issue of well-being laid out in the legislation that I've mentioned before. So one of the key themes that came up amongst all groups was that platonic friendships was something which were valuable, but romantic relationships were something different, and was something which was an element of the lives of people with mental health problems, which was often lacking and probably did need some support in some way. With people living with mental health problems, they identified this as important, and nobody sort of provided an exceptional view, saying they didn't find it important in any way. And so here's a couple of quotes that sort of illustrate this. So Adam talked about someone to confide in, someone to support you, and you can support, share your day with. And Barry talked about the wish to have physical contact with somebody on a nightly basis. However, within our study, when we talked to service users, they identified a range of systemic barriers that stopped them from developing romantic relationships with people. So we've identified these in a number of themes. So firstly, people with mental health problems talked about romantic relationships as an unavailable entity. So most of our participants perceived romantic relationships as something which were either unobtainable or difficult to develop and maintain because of the symptoms of their mental health problems or because of the side effects of medication. So in relation to the side effects of medication, there was quite often worries amongst men in particular about sexual performance and the effects that might have on feeling underconfident or shy. And then there was also self-stigma. So people within our study who experienced mental health problems often made a distinction between themselves and other members of society. And in one group, people talked about being normal or abnormal, and we're talking about people within those terms. So the issue of self-stigma is identified here in this quote from Gabby. So she says, if I were to meet somebody, I prefer that they weren't mentally ill, and I wouldn't like to have a relationship with another schizophrenic, but I'd like to meet somebody who would take me out of that, a normal person, a person who doesn't suffer with mental health problems, so I could live their way instead of worrying and anxiety. So this was quite a common thing that people identified, that they felt they wouldn't want to have a relationship with somebody else with mental health problems, because essentially their problems would be doubled, or because they wanted to meet a normal, in inverted commas, person. The other issue was self-stigma. So as I mentioned, people tended to make this distinction between normal and abnormal people. And they also sometimes worried about the relationship working out with somebody who didn't have a mental health problem due to a potential lack of understanding. And there was also other issues. For example, one person talked about hearing voices and always hearing a voice in his head telling him that he was going to fail in relation to mental health problems. So here, James says, I had one girlfriend when I became unwell, but then I got sectioned and I spent a year in hospital. She stayed with me for about 3-4 months, I think, and then she just really couldn't cope with it. So we called it a day, and that was the end of that, really. It was just too much for her. So people identified that, quite commonly providing support from people who were partners who didn't really have much experience of the mental health system, became too much for them. They just didn't cope. So this was a worry amongst participants, particularly in relation to disclosing mental health problems. So people worried about the stigma around violence and mental health issues. So people, were saying, well, I can't really tell people that I've got a mental health problem because then they'll make the assumption that I'm violent. And then there's also this issue about when should you disclose? So should you, get it out in the open earlier on, or should you wait until the relationship has built up a bit first? So within this theme, people also talked about their hopes being dashed in the past. So for many of our sample, people talked about a combination of past rejections and how stigma affected their romantic prospects, impacting on their confidence to build relationships. So Isaac says, I think if you have a mental illness, you have relapses, and that affects your stability. So it's hard to go forward in your life. So you maybe you get left behind, because I know my friends have kind of left me behind a bit. So it may be hard to get relationships for that reason, because you're not moving on. So it's definitely a minus. You are more outside society. And as mentioned before, there's this issue of disclosure came up. So in this conversation, Gabby says, it's probably best to keep it to yourself, to be honest. And Isaac says, no, it's going to come out one day. So why lie to that person all the time? It's best to be honest and lay your cards on the table. So moving on to the second theme amongst service users, romance was sometimes seen to be a private affair. So all our participants reported that the social care they received did not include help with developing or maintaining romantic relationships, but people were a bit ambiguous about whether they wanted that support or not. So some of those reasons were about embarrassment about sharing these issues. So Barry says, care workers are people like anyone else, and you're kind of asking them for advice on romance. I don't know, that's their life as well. They're going to draw from their own life and knowledge, and their romantic life might be private to them. I think it's a bit tricky, that kind of thing. So, in general, people felt a bit reticent to ask for help because they saw this aspect of their life as private and felt that care workers might also be worried about that. And on another matter, they also felt that care workers might be quite risk averse in the advice which they gave to them. So that was also sometimes a reason why they may not or might not seek advice. A further sub-theme here is lack of places and spaces to meet a romantic partner. So people here talked about day centres, community activities being withdrawn due to local authority funding cuts. So Charles here says, care in the community has huge cuts, especially day centres. Because day centres, they give you a chance to mix and meet people and do group therapy, like assertiveness training or anxiety management, confidence building, and to meet people. And that's all gone. So moving on to theme 3 for people with mental health problems. So first of all, people talked about practical support that was received by support services, and also talked about the importance of having consistent relationships within friend groups. So, within this theme, really, people are saying, talking about their social networks more generally rather than specifically about romantic relationships. So in this first quote, Barry talked about the importance of maintaining friendships in the absence of romantic relationships. So he says they're long-term, so they kind of give me a chance to say what I've done and to salvage the relationship. They've been making allowances for me for over years. People also talked about depleted social networks more generally, and Gabby here says, my family don't visit me, they don't contact in text or writing, they don't visit me, and they don't want me to visit them. So let's move on and think about what carers thought. So the first theme that family carers raised was the issue of emotional vulnerability. So carers identified that there was a challenge that people face in developing and maintaining romantic relationships. Like the service users in our sample, they talked about the importance of romantic relationships and that being a central thing in people's lives. But they also talked about mental health symptoms hindering meaningful relationships. And Kim here talks about one of these issues. She says, I think there's a lot of social isolation for people with mental health issues and issues of trust, really, all about who you can trust. When you give yourself to somebody and they're going to take advantage of you, or are they generally interested in you as a person? So family members thought that it was something that their loved ones wanted, and that they would want for them, talking here about romantic relationships, but then also worried about emotional vulnerability and potential abuse that the person with mental health problems might encounter. So the second theme they identified was romantic relationships as a potential stressor. So whilst carers wanted their relatives to develop romantic relationships, they worried that when things went wrong, it might cause stress for them, and that might then lead to a relapse in their mental health problems. And commonly they identified that their relatives didn't necessarily cope well with stress, and worried about what would happen in these instances. So here Beatrice says she's been in hospital quite often. We felt that that's contributed it to the relapse. It's been difficult within relationships. So thirdly, carers identified that support from social care services was something which was necessary in order to enable their relatives to build romantic relationships. And carers worried particularly about situations where there was two people with mental health problems and the problems that might raise. So Sam here says, two people with mental health problems in a relationship like that, a romantic relationship, I don't see how they can support each other if one becomes unwell. I think I would be very wary of that. So, carers had mixed reactions. And one of the things that got talked about was, things like dating websites and whether that was a good idea. And people had mixed, points of view about that because of the stress or that might cause, and also because of this idea of vulnerability. And the other issue that sort of came up in passing was the possibility of, staff being quite paternalistic in their attitudes. So lastly, let's turn to the issue of professionals. So a key theme amongst professionals was that they were fairly risk averse when thinking about romantic relationships. Commonly, what we found when talking to them was that they hadn't really thought about the issue of romantic relationships. But when they were talking about this, either individually or in groups, it was quite strange because there was almost a kind of light bulb moment where people said, oh yeah, we don't really support romantic relationships. Yes, that is a really important issue. Why don't we do it? So when professionals were talking about this issue, they identified that they obviously did things like needs assessment and care plans. And the issue of romantic relationships, if it did come up, only really ever came up indirectly. And it came up through asking people things like, what resources do you have in your lives? So, people weren't saying, do you have any relationships so much? It was more couched in those terms. For the most part, people were saying that they didn't routinely talk to people about romantic relationships or ask them about the kind of support they would want to have. There was one exceptional case to that where the care worker talked about the steps that she'd take, but largely speaking, people didn't. So when they did consider it, they tended to talk about it in terms of, you know, risks that people might have, such as risk of financial exploitation or risk of domestic violence. So, you know, this sub-theme, the first one is, you know, waiting for the need to arise. People didn't talk about it unless they were asked about it. And the second theme here, sub-theme, is this issue about emotional risk. And Philippa here says, so it feels like when you're working, it's when you look after a plant, it's almost like you get to the stage where the shoot is really tiny and delicate. And it's kind of, for me, like the relationship is like a tsunami that could come through very fast, and anything that has been brought up can deteriorate. So this was quite common, this kind of feeling amongst professionals. They tended to present service users as being very vulnerable and say, well, you know, we really need to get them well, and you know, encourage them to concentrate on getting them well, because if something happens, if the relationship goes wrong, then that can be quite damaging to them. So you know, this was quite common amongst most professionals. So the second issue that came up amongst professionals was this issue around talking about intimacy. So generally, staff identified that they were very uncomfortable about talking to service users about intimacy or about sex. Where such discussions did occur, they tended to happen for two reasons. So one, in some cases, service users came forward and said that they were having problems with the psychiatric drugs, specifically around things like a lack of libido or things like erectile dysfunction. So in those cases, it came up and a conversation would be had about it. Secondly, there was issues where people identified that somebody might be in a sexual relationship which appeared to be exploitative, or there might be an issue of concern because somebody appeared to be sexually disinhibited as a result of their symptoms. But people who were professionals said they tended to sort of, you know, only deal with intimacy in those situations. So Philippa here says, I think with me, there's only so much I want to know about other people I support. I used to support an elderly woman who was too open about her hygiene habits, and I actually wanted to know, and I felt that I needed to be involved with. So it's a little bit like that with sexuality also. With that, there's some things that I'm thinking, do I really want to be involved with that? So there's something about a personal comfort zone. And the other issue that came up was when staff were told about sexual intimacy issues, they had certain strategies of dealing with it, which weren't always optimal in my view. So, you know, one of the things that came up quite often was there was an issue that service users on a mental health ward might be in a sexual relationship with one another. So generally staff you know, might intervene if they felt somebody was vulnerable, but in other cases they sort of had an out of sight, out of mind policy. So one staff member talked about encouraging people to go for a coffee with one another, which was a sort of coded speak for, you know, if you want to go and have sex, that's fine, but don't have it on the ward. So, you know, issues were sort of acknowledged, but not really dealt with in a straightforward way. So let's move to the discussion and conclusion and think about where that takes us. So if we compare our study to other studies which have been done in the past, our study echoed the findings of previous studies in that people with mental health problems identified that romantic relationships was something which were important. Our study adds some new findings in the sense that carers and professionals also consider this to be important as well and central to the idea of well-being. So as I mentioned in the study, there was a common perspective amongst all groups around barriers of forming and developing romantic relationships. So both the service user and carer groups talked about some of the symptoms that you would get and the side effects of medication as identifying you as mentally ill, and that being hindrances to developing romantic relationships. Even where those things weren't present, people were aware that there's quite a stigma around having a mental health problem, particularly around this sort of idea of people commonly being violent, and that may pour cold water on a developing relationship. So despite current policy and guidance, most of our service user and carer cohort felt that there was little support, and that only tended to be offered in cases where people were reporting things like sexual dysfunction or sexual harassment, so essentially where there were risk concerns. So we think there's a few things that need to come from this. So we think there's a need for a broader study that seeks to examine people's social care plans and how far these things are looked at, and an in-depth sort of exploration of the kind of social care interventions which might be offered in order to help people develop romantic relationships. So when we're thinking about these things, it's sometimes helpful to think about other areas of practice. And if you look into the learning disability literature, you can see that quite a lot's been done in regard to this issue. So there's some training packs which help train staff to talk about the issue of sexual citizenship. So in a learning disability literature, there's an acknowledgement that staff have seen people as being asexual if they have a learning disability for some time, and a need to sort of overcome that and to talk about these issues and offer support in developing healthy sexual relationships. So I think that there's work that could be done in terms of support packages for helping people to identify their aspirations in relation to romantic relationships and sexual intimacy, and offering training in terms of, you know, how you might deal with potential problems that might turn up, and how you might resolve those issues. So in summary, we would offer three main recommendations as a result of our study. So first, as I mentioned, a larger, broader mixed methods study could be conducted, which could look at care plans and the calculations that people have around their romantic needs. Secondly, we think that, you know, drawing on the literature from the intellectual disability field, we could think about how support groups might be formed. And third, in the absence of daycare facilities that some of our people mentioned, we might also think about alternative support platforms, social events, you know, dating apps or things of that nature. So that's the end of the presentation. Thank you very much for your attention. In a moment, I'll put up the link to the full paper, and it'd be really good to get a discussion going amongst people here, or to hear any comments or questions that people have. So at this point, I'll pass over to Jonathan as the chair to manage that process.
Thanks very much, Jeremy. We have got one question. Can I ask one of my own first, just to kind of frame it really? I'm guessing you made a deliberate decision to use the term romantic need. So you didn't talk about sexuality, for example, which is I more commonly come across that, particularly say in relation to people with learning disabilities. More if you hear about the importance of sexuality, sexual citizenship. Can you just talk about that, your choice of words and your choice of framing? Well, presumably that was a deliberate thing. What did you have in mind about the parameters and so on?
Yeah, thanks for that question. So what we did in the early part of the studies, we had a steering group with people with lived experience and also with services. So I suppose the idea for the study came up because I was having a conversation with Rachel Forrester Jones when she joined the University of Bath about, you know, the kinds of things that studies typically look at, and you know, and what they maybe neglect. So we were talking about what mental health research has been done, and you know, where the gaps are. So within that conversation, I think she talked about, generally this sort of social network studies which have been done, essentially about friendship networks. And, my response to that was actually, well, the one thing that tends to get missed is, romantic or personal relationships with people. And I suppose I was informed by that with, some conversations with a friend of mine who's got schizophrenia, and commonly talks about the sort of wish for a romantic relationship. So when we had the steering group discussions, I think we talked about, well, how should we frame this problem? And it was quite interesting because I think the people who were the service providers were saying, well, it could be quite, risky to talk about, romantic relationships or personal relationships, and maybe it should be a broader study talking to people about their social networks more generally and as romantic need as part of that. But the people with lived experience in our study sort of, had an opposite view. So they were saying, well, actually, what tends to happen is, people have this view that it's, people with mental health problems are, overly vulnerable, and this is, a main part of mainstream life and should be talked about. So I think we use the term romantic need or romantic relationships because we sort of settled on that with the steering group, because we felt that it was a term which could be sort of easily understood by people. I think we differentiated from sexual relationships because that's something which has been explored a bit more in the literature. And whilst, sexual relationships obviously is part of a romantic relationship, it's not, the full picture. You could have a casual sexual relationships and not develop a romantic relationship. But, developing partnerships and dating and those types of things are things which we tend to see as intrinsic to, good quality of life. It's within all the sort of, in the media and, within our families. So we felt that that was something which had been missed. And so, yeah, that's why we use that term really, because we just thought it was easily understood.
Yeah, that's great. Thank you. Yeah, I was assuming you were wanting to, distinguish from what could, as you say, sexuality could refer to something fairly casual, which is a very different kind of thing. Okay, thank you. So Alison's question then, Alison Rees has written in the chat. Thank you, Jeremy. That was really interesting. What are the things that social workers can do to help support romantic relationships? So perhaps you could expand a bit on some of what you started to touch on at the very last slide there.
Yeah, thanks. So I think the thing that came up, as I mentioned in the findings, is that people just sort of tended to avoid the conversation altogether. So the most obvious thing they could do is to actually raise it as an issue and ask people, if it's something, do they have any romantic relationships going on? And then if they don't, is that something that they would want to develop? Is it an ambition that they have? And is it something they would want support with? So people tend to talk about, support structures within wellbeing, or, tend to couch it in very sort of general phrases, or, what support do you have available to you from family and that kind of thing. But they're very rarely explicitly asking people, do you have a romantic relationship? Is that something that you'd want? So I think that's, quite an obvious thing, but it's something that obviously seems to get missed out as well. So, for it to be an explicit thing within care plans and assessments would be the first step. I think that the second thing is, maybe, thinking about support groups that could be offered. So when I used to work in mental health, actually a nurse had taken it upon herself to organise a support group for people with mental health problems about things that they might do to develop romantic relationships. And I think she just sort of done this herself because she identified that most of the people she was working with said they wanted it, but she was thinking about things that, well, what would a partner want from you? And I think in her mind, some of the things that she was encouraging people to pay attention to was things like personal hygiene, for example, because she felt that obviously that was quite often an inhibitor that people didn't necessarily think about, but a partner would want. But also I think more general things about how would you approach people, what kind of conversations do you have? So having some discussions around those things would be useful to people, so people can self-support. Within the focus groups we had, some people did have long-term relationships, and some people were married. So having those conversations, with peer groups could be useful. The other thing that we talked about a bit in some of the focus groups was this issue about dating. So I think at the time at which we were doing the focus groups, there was a Channel 4 program on called The Undateables, which is a horrible title. But like a lot of Channel 4 programs, it sort of has this sort of sensationalist title, and then it actually has quite sympathetic coverage. So that was largely with people with learning disabilities, where they had these sort of matchmakers. And there were some conversations around that, and people had quite split opinions on this within the service user group, actually. So some people were very keen on it, and we'd done a bit of research and sort of looked up, were there things available for people with mental health problems? And there appeared to be, but we couldn't sort of really identify the quality of those things. So some people were like, yes, I'd be definitely up for that. And can you give me the number and tell me, pass on the details of it? And other people were like, well, no, I don't really like the idea of that. That seems to be, quite discriminatory, and, seeing people as mental health problems as different from the rest of society. So yeah, it was quite different really in terms of what people said about it. But I do think that there would be scope really, maybe in a training package that you might develop as part of a research project, to talk to people like dating agencies about the type of things that you might develop, and are there ways of maybe doing some sort of matchmaking around those things. So I can see a question from Paul as well. So I think Paul says it's interesting that similar conversations about sex and sexuality were also missed avoided in social care assessments and care plans. Yeah, so I mean, I thought that was interesting. And again, I think there's a need really to sort of not shy away from the conversations, but maybe to be explicit about them in one-to-one conversations, when people are on the ward. I used to work in a forensic unit, and again, this was something that people, shied away from in a similar way that staff discussed. So, ward staff used to say that it's never really acceptable for there to be a sexual relationship between service users, because it could be exploitative, which I always thought was a ridiculous position to start with, because in those environments, forensic environments, people were locked up together for long periods of time, and so it was almost a fait accompli. I think that people would develop intimate relationships with each other. So I thought there was maybe a greater need to look at people's capacity and how you facilitate that safely. And also in some ways by just sort of saying, well, you can, if you have sex off the ward, that's fine by us, but don't, do it in the hospital premises, is actually sort of pushing aside your responsibility to, think about those things and, help people to sort of develop those things in a safe way. And, quite often when people are on the ward, that is when they're most vulnerable. So actually having conversations around safety would be something which, would be sensible in my view.
Thanks, Jeremy. Sorry, I was trying to speak a minute ago, but I left myself on mute. Sorry. Thanks for picking up on the chat box. Can I just come back to the matchmaker thing then? So the matchmaker idea, I've never watched that Channel 4 program, although I do know of it. It is presumably people. It's matching people with learning disability with other people with learning disability, presumably. Yeah. And the idea for the mental health context would be this the equivalent thing. So matching people with mental health problems with other people with mental health problems. Is that right?
Yeah.
Okay.
Yes. So I think that could be something that could be facilitated. So I mean, the useful thing about the learning disability service, which was shown on Channel 4, was that the person who was making the match would go and sort of speak to both parties, people who wanted to put themselves forward for that service beforehand, and would get a sort of clear idea about what it was that they wanted from the relationship. And I suppose, didn't necessarily show this, but what their expectations might be around things like sexual intimacy and those types of things. So they might identify, do they want a sort of more of a friendship relationship, or do they want it to develop into something more intimate? And so those things would be thought about to begin with, and also there might be some sort of skills development, and what kind of things might you say, and in that program they were, I suppose, helping people to sort of deal with nerves, because a lot of those people hadn't been on dates for a long time, and also I suppose managing expectations and what do you do should things go wrong. So if the person doesn't want to see you again, how do you manage that? How do you move on from it and maybe think, well, okay, that's par for the course.
I see. Yeah.
How do I go on to the next relationship?
And then your group of service users that you were discussing this with had split opinions about whether it was a good idea to be paired up with other people with mental health problems.
Yeah. So I think people just have very different opinions about, some people that would be a good idea and others not at all. And I think that, again, there's different opinions amongst people about, as I mentioned earlier, about whether they would wish to be in relationships with people with mental health problems or not. So, sometimes you could say it was self-stigma in the terms that, but I think in other senses it could be seen as reasonable, in the sense that I've got enough problems with my own mental health problems. I don't want to be dealing with somebody else's as well. So I think those things need to be thought through with people and just talked about openly, really.
Yeah. And Sian's just noted just the observation that the programme Undatables also covers physical disability and neurodivergence as well. Thank you, Sian. Jeremy's just put the link to the paper in the chat. Is that a full text, Jeremy?
It is a full text and it's free to access. So
excellent.
Yeah.
Full text, open access. There's no paywall there. If you click on Jeremy's link, you can get straight to the full paper. And these are not terribly. These are only papers of like 6,000 words or something. They're not too huge or time consuming if people want to read. But that's great, Jeremy. Thank you very much. Very interesting and kind of distinctive topic, really, with a couple of interesting questions there at the end about how we can put it into practice. So thanks everybody for coming. Do keep an eye out for other ExChange events. We're in the middle of a mental health series, but we do events in ExChange on a whole range of social care issues, both children's and adult social care. So do keep an eye out in our bulletins. And if you're not sure if you're on a mailing list, you can, of course, email back in response to any webinar invitation you've had, and we can just double check that you are on our mailing list. Thanks for coming, everybody. Some thanks in the chat there. We'll see you again soon.